Hello, 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 hello. This is Delcina, and let's see, I had shoulder replacement surgery on Monday, Tuesday, Wednesday, Thursday, 3 days ago. So I wanted to share something with you about what they're doing to help to reduce my pain, because I'm a big, big chicken when it comes to pain. Yes, I cannot stand to be in pain. I'm scared. So I want every possible options to decrease my pain throughout my recovery. Because then too, if I'm in a lot of pain, I don't want to do the physical therapy. And you have to do the physical therapy in order to recover properly and get your range of motion. So the doctors have put in this very, very tiny needle tube into my neck here, if you can see, and it's connected to this little tube right here that is connected to a nerve block medicine that is automatically secreted into my skin on a regular drip basis. And here is the nerve block medication. I have to carry around this little fanny pack with this everywhere I go until it's completely dissolved and drained into my skin. And it can be adjusted with this select the flow adjuster right here. And when I was in the hospital, started at 8, then 6, now it's down to 4. And it slowly releases nerve block to decrease the nerve sensations or the pain feelings that you get after a major surgery. You know, when they cut through the skin and cut through the muscle, and then they have to cut through the, they cut the shoulder muscles, and then they have to cut through the infraspinatus and all those muscles, the rotator cuff. Anyway, so normally I would be in a whole lot more pain. But thank God, because of this nerve block, and then, of course, the narcotic they give you, I don't have to take as much, which is really, really good because it'll allow my body to heal better. Because if you're not under so much pain, you can do your physical therapy, right? And I need to start my physical therapy. As a matter of fact, I start today with my physical therapy. But the sooner we start, the sooner I can get back to normal and as much range of motion as possible. Speaking of range of motion, because they weren't able to do a regular shoulder replacement, because I did not have enough bone, enough healthy bone and tissue to do a regular shoulder replacement. Yeah, because it happens every single time they go into my joints. They say, oh, it's going to be okay. It's not that big of a deal. And then when they go in and they open me up, they realize, oh my gosh, that's worse than we thought it was. So they went in there and they went, oh my gosh, it's worse than they thought it was. So they had to do a reverse shoulder replacement, which they reversed the position of the ball and socket. So there's a little less rotational move in this position. This is like 180 degrees. They said maybe I'll get up to 150, but I'm going to push as much as I can to get back to 180 degrees because I won't be able to do shoulder presses and overhead extensions and things like that. You know, we'll see how it goes. Anyway, so I just wanted to, I'm dragging on, tell you about this new thing for me, which is this nerve block that you stay with you and continues to drip through inside of your skin. You can't let it pull, because if it pulls the tube out, you can't put it back in. It's like toothpaste, you know, once you squeeze it out, you can't put it back in. And this is decreasing the pain so that I can start my physical therapy and take less narcotics and be able to wean off of that and continue on with my healing. I hope this has helped you or anybody else you know who might be having shoulder replacement surgery and want to find out about ways to decrease their pain along the way. So I have to put my little nerve block medicine back into the fanny pack like this. Zip it all up because I don't want to lose any pieces of it. And I carry around my little fanny pack everywhere I go until it's completely dissolved into my tissue. I hope this has been helpful to you. And also, let me know, should I do makeup and stuff before I get on Facebook? Because I look pretty jacked up. But I guess I can't expect much. I just had surgery 3 days ago. Okay, well, bye guys. Take care. Hope this has been helpful.